we have 5 minutes to answer any question before we go to the next topic. So I would like to welcome our first speaker, Dr. John Adegboye. Dr. John Adegboye is a consultant psychiatrist with subspecialty in adult psychiatry, attention deficits, hyperactivity disorder, and psychiatry of intellectual disability. He has about 30 years experience involving academic and clinical psychiatry. He's a fellow of Royal Australian and New Zealand College of Psychiatrists. He's the former medical director of Blackwood River. He has been in ministry for over 20 years. He's married with 3 adult children, all in their 20s. So please employ me to welcome Dr. John Adegboye. Thank you for coming. You're welcome, sir.
I want to thank Daddy Hastrop, who has taken it upon himself to get me to be part of what is happening today. I'm particularly delighted because I have a deep passion for addiction and addictive disorders. I'm one of the grandfathers of addiction psychiatry at the college. And my main practice involves seeing people who have addiction. And so a big chunk of my practice, up to probably more than 50% of the people I see on daily basis will have something to do with addiction. Now, without taking much of our time, I have tried to answer a few questions by this talk. The first thing is, why do we want to know about substance use disorders? And as I proceed, I will try to link it with mental health and other aspects of life, because when you talk about addiction, I often tell registrars, that is doctors who are trained that pass through me, that if you know addiction, then you know psychiatry. So why do we want to know about substance use disorders? 2, can I have a healthy relationship with substances of abuse? In other words, can I use drugs healthily? 3, who are those who fall into the trap of substances of abuse, that is drug abuse? Who are those who fall into that trap? Number 4, how do I know when I start to have problems with substances of abuse or drugs? In other words, how will I know if I'm starting to have drug problem? Number 5, what can I do if I think I am having problems? And then I've looked at what I call other issues. And among other issues will be the issue of stigma. Another issue is, am I a bad person if I'm using drugs or if I have drug problems? And then we will look at what are the likely outcomes, what we call prognosis. What usually happens when someone is doing drugs? So I'm going to start by quickly looking at why do we want to know about substances, the issue of substance use disorder or drug use, put simply. We want to know because drug use has impact on individual development, both physical, social, intellectual, emotional, cultural, and spiritual development. It has impact on physical health. For example, depending on the substances that one uses, there may be specific, I hope this is okay. Okay. There may be specific impact on different parts of the body or organs. I'm going to be referring to some of the common things that that people use. For example, alcohol, we know, has the ability to affect almost all organs of the body. In 2018, there was a study that was sponsored by Bill Gates and his wife that looked at alcohol consumption in 195 countries over 26 years. And one of the findings is that alcohol has impact, particularly in the causation of cancer, up to 13 different kinds of cancers. And that the only safe level it's freely available, this study, if you Google it. The only safe level is actually 0, because in terms of all mortality, that 0 is the level that is safe. So it has impact. But we are talking about the extreme impact, but there is also the immediate impact that it has on organ system, depending on the individual and what else is happening in their system, from the brain to the heart to the liver and what have you. There's also the impact on mental health, which is my area. I'm a psychiatrist. We know that 30 to 50% of people with mental health also have ongoing substance use problem or use substances to a degree. We also know that it is true the other way around, that the people who use substances, 30 to 50% of them will have other mental health issues. And often the relationship between substances and mental health can be a bit complex. One is that the same genetic problem that predisposes an individual to mental health can also be the one that leads the individual to use substances. 2 is that mental health itself can often be a reason why an individual will use substances, and that in some people, the use of substances will cause mental health issues. For example, we know that there are individuals who develop drug-induced psychosis after the use of substances like methamphetamine. There are controversies about what or the impact of cannabis will be. We do know that in some countries, particularly in these Scandinavian countries, they have done extensive studies to show that individuals who start to use cannabis very early, usually before the age of 15, if they are going to develop schizophrenia, for example, which is a psychotic disorder. What is psychosis? Psychosis simply means when you begin to lose touch with reality, you don't know what is real from what is not real, like hearing voices, thinking people are about to harm you or going to do you evil and things like that. Or things begin to have special meaning to you, or thinking people know what you are thinking when you have not even told them, which is a very, very serious disorder. They show that individuals who use who use cannabis before the age of 15, if they're going to develop this condition, they develop it earlier than others who have not used. Also, we know that people who have this condition, when they smoke cannabis, are likely to have more frequent relapses, and the outcome may not be as good. Violence has also been associated when an individual have these conditions and do drugs with them. Also, there can be direct toxic effect as a result of drug use. Cannabis is one of those things that people see that after someone has smoked, they become confused, and have what we call psychotic problem. And individuals who are already prone by reason of their genetic makeup, when they start to use substances, may develop frank mental health issues. And of course, one common thing is to talk about what we call medication or self-medication hypothesis, that individuals who have mental illness use substances to treat themselves. And on other occasions, when someone who has mental health is being treated, some of the side effects, if they are not discussed properly, can lead an individual to wanting to do or use substances that may help them to combat some of these side effects. And we also know that drugs can exacerbate or make worse pre-existing mental health issues. There's also a complex relationship in the sense that, and I want us to listen to this very well, that drug use may lead to mental health issues through what I call disrupted development, as well as losses and risk-taking behavior. And I'll quickly go through this. One, when an individual is growing up, particularly from teenage years to early adulthood, there are certain things that is part of your development, which is learning to cope, managing relationship. That is usually the time that parents and young ones will get into a bit of friction because they see things differently. That is the time that a lot is expected of you to study, choose your career, vocation, and what have you. That is a time you begin to form relationship with other people. That is a time that there are expectations on you to be more independent. A lot of the things that parents will guide you or help you to do before, they expect you to begin to take over. Now, this is a time that most people find difficult to transition. And hence, that's the time of a lot of anxiety. It's been shown that most mental illnesses tends to occur around this time. It is also this time that the individual discover drug use. And I see a lot of people who struggle, particularly in high school, they can't fit into group, but they find acceptance among the group of people that use drugs, for example. And so they develop, drug use habit. But the problem with this is this. One of the things that help people to grow in life is how they learn to navigate or overcome or deal with life struggles. That is how people mature, become experienced, and grow in themselves. But when you discover drugs at this stage, it takes away your anxiety, your care, and your worries in the immediate. But the problem with that is this: you will never learn the skills you need to do life. It is often said that most people get stuck at the level at which they start to do drugs. Their age may keep increasing, but their ability to manage life gets stuck at the level at which they are introduced to drugs and they start to do drugs. And that is why if you know anyone who has drug problem, no matter how old they are, you can see that their choices show immaturity, impulsivity, ill-considered choices. So because of this disrupted development, you will then lag behind compared to your mates. And as a result, there are losses, often in terms of advancement, achievement, in relationships, in profession, and many other things. And so the individual becomes quite prone to develop other mental health issues, such as depression, anxiety, and so on. And of course, one of the things associated with drug use is risk-taking. Most people who do drugs will take risk at many levels: sexual risk, physical risk, in driving and things like that. And then that makes you prone to other conditions like infections, motor vehicle accident. People, I know of a young man who had first class in engineering. This young man was a Christian when I was in Nigeria. He was a Christian. He went through FG, Federal Government College in Kaduna. He went through university as a Christian. And then he finished with first class and was employed by Chevron. Then he picked up the habit of drinking. And one day he was drunk. He had a motor vehicle accident with serious head injury. And subsequently, he developed what will appear like, bipolar affective disorder, often manic. And that shattered his career and changed his life permanently. So, risk-taking behavior. And of course, there are changes that take place in the brain. For example, it's been shown that individuals who start to use cannabis before the age of 15, even when they stop later in life, may have permanent changes to their brain. And adults too, who use cannabis later in life, tend to have changes to their brain. So all these things would then affect individuals' ability to respond to life situations and choice making, and then they become prone to mental health issues. And of course, there are things that are shared between other mental health issues and substances, including impulsive behavior and things like that makes the individual quite prone to either of the condition, mental health issues, and so on. Then, of course, there's also the impact, the economic impact. If the individual is not able to follow through their dreams, school and study, vocation, and so on, that automatically disadvantages them because they will be in the lower socioeconomic rung of life and all the other things. We know that most health parameters, most health indices in life does not favor one when you are at the lower end in terms of choice making from diet to, options that are available to you. There also the impact, of course, in individual spiritual and moral life. And I've had patients say to me that I never thought I'll be able to do this, or never thought I will ever make choices like this. I actually had a woman say that to me just today. And she was telling me, this is a married woman with 3 kids. And she said, I never thought I would give myself to get drugs. I never thought I would be selling my son's medication. So the impact is widespread. Hence, we want to, we're interested in looking at this. Can I have a healthy relationship with substances of abuse? In other words, because you hear people tell you that I know a lot of people who have smoked cannabis. They will tell you about Obama. They will tell you about George Bush. They will tell you about Bob Marley. They will tell you about other prominent people. The truth about it is this: you will never know what the outcome is going to be for you. You never know, particularly what your genes are. Make you prone to. Not only that, it also depends on the circumstances you are in at that time. So the outcome is unpredictable in terms of the way it's going to progress from using casually. But what I've seen over the years is that even people who said they use casually and appear to function, most of them never attain to their full potential for the reasons I've given you before, because it takes their pain away and they don't have to deal with life. I call it a way of emptying one's bucket instead of addressing issues. So it's a way to avoid actually dealing with things. Thirdly, who are those who fall into the trap of substances of abuse? Anybody. Anybody can. If you ever get exposed to it. I've seen individuals who told me that they tasted a substance once, and years later, up to 5 years, 10 years later, when things are hard, you heard Daddy read, Cast Your Cares Upon Him. When things are hard, they go back because they've had a taste of it before. They never planned to, and it was not their intention. But if you have not learned to deal with life that way, your chances of going to it, it's slimmer than somebody who has had a taste of it. And what a lot of people describe is this, particularly with substances like methamphetamine. They will tell you that the kind of feeling it produces in them is often not replicated by other things. And so the problem is the normal things that make other people happy, the normal things that make other people feel fulfilled, the normal things that make other people contented with life will no longer be sufficient for the individual who has been exposed to drugs. One of the things I tell people, my patient, and when I give talks like this, is that I say drug is very, very stupid. And people wonder, what do I mean by that? I tell them that, look, the impact of drugs on you does not discriminate. So in other words, the drug would not treat you differently because you have had trauma in your life, because you are merely experimenting, because you are upset, because you are struggling. It does not. The impact it has on an individual is the same across board. So for somebody who is quite prone, irrespective of why they started, it can still become a problem. And one of the major things about drug use is this, is that it takes a long time before it becomes known as a problem. If it becomes a problem the first time you take it, you probably stop. But most people who will come to attention, to say my attention, will have history of 10 years, 15 years, or even 20 years. And so what then happens is that there has been a lot of adaptation, changes in the brain, in the emotional response, and emotional calibrations that you use to operate life. And so it's often not easy to get out of it. And so there will be processes to go through in order to be able to come out of it. I will speak a bit more about that. What can I do if I think I am having problems? Help is often needed. The starting point is this. Just in case you are not able to confide in people that are close to you, go to a general practitioner. Talk to them, get them to refer you to somebody and to who can assess the level of the impact is already having on you. And you know when it starts to become a problem for you from this. One, you find out that you become increasingly unorganized. You will not be able to keep appointments and meet deadlines. You will begin to find the reason for it. Your expectation of yourself will start to drop because you begin to find reason for it. Your mood may start to change, and you may begin to experience unexplained anger, usually when you are withdrawing and you take offenses. You may become increasingly withdrawn or restrict your social circle to those who will supply you with what you need or people who will do the same thing as you are doing. In fact, it is well known that most people tend to rearrange their lives not to be too far away from where they can get, use, and recover. And a whole lot of things that surround that. The other thing is that you may begin to compromise your normal standard and find excuses for it. You also notice that when you are upset or when things are not going the way you want them to go, you may seek recourse in using. Now, I always tell people that it's not only when things are bad. When you are feeling good also, when your friends have their bad day and you are excited, may also become a time that individual may start to use. So it becomes something you use to regulate yourself. It's often good to keep an eye on things like this and confide in somebody, because one of the things that make it go on is secrecy. So you need to be aware when you are beginning to become secretive. And of course, the other problem is that it does not come alone. Usually, up to 60% of individuals who use one drug will also use another one when their preferred one is not available. And so a lot of people may tell you they've given up this, but when you actually probe the history, when they say they gave up this, they probably have switched on to something else. So watch that. It may involve things as simple as prescription medication like Valium, and other, what we call benzodiazepines, sedatives that calm people down. So seeking help, talk to a confidant, talk to your pastor. I know that one of the major problems is stigma. And hopefully, with this talk, if there are any of us who hold position of authority and the youths come to us, we need to be aware that the process of an individual becoming involved sometimes can be very accidental. It's not because an individual is bad. And it gets to a point that it becomes an automatic system. It becomes a way of dealing with life for this individual. And at that point, we look at it more as a kind of medical problem. It often, now talking about prognosis or outcome, it often can linger on and on and on. Because, often characterized by what we call relapses. So the individual may give up for some time and go back to it. So that is why it's good to seek help. Oftentimes, it's not something you just do by yourself, because you need point of accountability. And I tell my patients or individuals, I say, look, there are two things to account for. Learn to account for your time, because you cannot do drugs without time. It's like a relationship. You cannot be in a relationship with somebody without spending time with them. So when you begin to sneak out, find excuses, delay, or, so your time you account for. Find somebody you can be accountable to. 2, drug revolves around money. If you're having problem with drugs, you have to make sure that you are accountable for your money. Find somebody you can be accountable to, because often money is the lifeline of drug use. If you can find a way of controlling this and make yourself accountable, that will also help you. In addition to sometimes specific treatments that are needed, for the treatment of whatever substances an individual is using. Oftentimes, people look at it as a moral issue. It goes beyond being a moral issue. There are stages of development that people go through, and they accidentally get into one trap or the other. And so we need to support those individuals and help them to overcome the situation. Now, I'm sure, Daddy has my email, and if need be, I'm happy to give my number to individuals so that if anyone wants to talk to me, they'll be able to talk to me. I think I will leave it at this point. Thank you.
Dr. John, we appreciate you for that wonderful exposition and revelation. I jotted a lot of things down um, about the effects of drugs, especially the abused on mental health. For example, cannabis causes permanent changes in the brain, affects individuals' ability to achieve life goals. There's economic implications, and most of the time, help is often needed. And we were told signs of these drugs of abuse increasingly becoming organized, begin to find reasons and expectations that are dwindling, especially during withdrawal, and so on and so forth. I don't know whether anybody's got questions. We have about 5 minutes to ask questions before we go on to the next speaker. Anyone, you can raise your hand from the chat button or look for the icon. Raise your hand if you have any questions. You can drop your question in the chat box. If there's no one at the moment, if you still got questions, just jot it down. You can drop it. I believe we'll get it across to the speaker and they will get across to us. Let's go to the next talk.